I was fairly healthy before my SCAD, and I didn't have any warning signs. What might have caused it?
That's a great question. And physicians and scientists still don't know exactly what causes SCAD in all cases. But there are a few important things that we do know. For example, we know that the condition often affects young and otherwise healthy women without the traditional cardiac risk factors such as high blood pressure, diabetes, high cholesterol, smoking history. In fact, 90% of patients who experience SCAD are women, typically between the ages of 30 and 60 years, and they're typically quite well. We also know that SCAD is responsible for about a quarter of heart attacks in women under the age of 60. So this is a pretty common condition.
It is, and we don't know much about it.
We don't, but we do know that there are certain risk factors for SCAD. So for example, the use of hormone replacement therapy with estrogen and progesterone can potentially increase the risk of having a SCAD event. Severe emotional stress and intense physical activity can also trigger SCAD events. SCAD can also happen during pregnancy and in the postpartum period. And women who have had many pregnancies seem to be at increased risk of a SCAD event. And finally, SCAD can occur premenstrually or in the perimenopausal period where natural hormone levels can fluctuate. And this really emphasizes that there does seem to be a hormonal component to SCAD events for many women. Other risk factors can include conditions such as fibromuscular dysplasia, certain connective tissue disorders, or systemic inflammatory diseases that might affect the arterial walls. Finally, we also know that cocaine use can be a risk factor for SCAD. While there's still a lot that we have to learn about SCAD, rest assured that this is an active area of research, and many women, many scientists, and many physicians are all coming together to really drive ongoing education and research in this area.